My name is Jeff Jorgensen, and I am an otolaryngologist, otherwise known as an ear, nose, and throat doctor. So I grew up in Minnesota, although it's kind of sad because I really haven't been back there to live since high school. But I went to college in the East Coast in New England, which I loved, worked out there for a couple years, and then went to medical school in Tennessee. Kind of moved around quite a bit, actually, but then I was in Kansas City for a while for my residency and fellowship, and then I practiced in Missouri as well as Kentucky. And so now I'll be moving down here to South Carolina, so it's been pretty circuitous. So ear, nose, and throat doctors will tend to think of ourselves as people that can treat things or treat disease processes in the head and neck. Excluding eye problems and brain issues. And so skin lesions, thyroid issues, mouth and throat issues, swallowing problems, dizziness, hearing loss. My particular specialty is head and neck cancer, so I will tend to treat people with malignancies of the head and neck, including thyroid cancers. But within that, we'll treat many benign processes as well, because patients will have benign growths in their head and neck and other issues as well. So yeah, that's what I mainly treat is head and neck cancer. You know, when you're in medical school, I think you have that decision process of do I want to go into surgery or do I go into medicine? And I decided I liked ear, nose, and throat early because the people that were within that specialty, I kind of really felt like I got along with and I enjoyed being with them. And so it's much more of a family feel at first. And then when I started going through training, as you go into your 5-year ENT training, you kind of are exposed to many different aspects to it. You know, ear surgeries, laryngology, pediatrics, etc. And when I was doing that, I just really felt like I was drawn towards the head neck cancer patients. There was a difficult, patient population just in terms of difficult care for some of these patients. But I was really drawn to that because I felt like it was an important role that you could help patients get through, and I guess different people have different reasons to go into medical school in the first place, but that was what it was for me, was to hopefully be somebody that could help patients through a difficult time. And so I just, no matter how hard I tried to probably fight it for a little while because it's a little bit more of a difficult specialty, I ended up just being very drawn towards it in the end. Well, I think it's by being an advocate for them and trying to be less of a physician, I hope, and more of a friend to them, to somebody that kind of helps them through this process, that gets to know them and their families, and they probably will get to know and hear about mine and my family quite a bit as well. But I think when you kind of bridge that gap between being a clinician and more of an advocate and a friend and somebody that, they just feel that they've identified with and has been important to them for a while, I think then you break down a lot of barriers of trust. That's important. So, they may ask my opinions on certain things about, quitting smoking, chewing tobacco, those types of things, and I'll just tell them honestly without scolding people. I just don't think that ever works. So my wife and I have 4 children, and that certainly keeps us busy most days. And I have to say that I do kind of fashion myself as a bit of a family man, and that's probably where I spend most of my free time, in all honesty. But the things I like to do is to get outside, and that's why I'm really looking forward to moving to Greenville. I enjoy hiking, mountain biking, as well as snowboarding now. I take an annual trip every year to Moab with my best friend to go mountain biking for a week, and my wife hates the trip because she says it's too long every year, but she still barely lets me go on this trip. But I had actually just recently sold my mountain bike because we always rent when we go out there, so I'm actually looking at buying a mountain bike again now because I know there's a lot of great mountain biking around Greenville. So that'll be the thing that I'd like to do the most, is to get outside, hopefully get my kids outside as they get a little bit older too. But yeah, to make an appointment with me, please call the number on this webpage.